Hey, Remar nurses, I have one question for you. Have you studied for NCLEX? Have you studied for NCLEX? We are on day number 23 of our 30-day NCLEX challenge. You made it to day 23 here live. And if you know what today is, we have a whole lot of psych that we covered today in the virtual trainer. That's right, we're studying from the VT student workbook, also the quick facts for NCLEX, and I have to review the major themes with you. But before I do this, I have some announcements. All right, announcements. Hi guys, you are here for the live video. It's going to be so good. Announcement number one. The coupon code INVEST that we have been giving out expires tomorrow. So it will not be good after tomorrow. If you're interested in getting the virtual trainer, get the virtual trainer tonight. Use that coupon code. If you don't, tomorrow that price is jumping up. Okay. So that's announcement number one. It's 2:30 in Ghana. Shout out to all my nurses in Ghana. Oh, shout out to my nurses in Jamaica, Nigeria, Ethiopia. Where else do I have representing today here? Hey, this is the live video. if this is your first time watching, you're in for a treat. Okay. All right. That was announcement number one. Discount code expires in 24 hours. All right. Announcement number two. Yesterday, when I was going over a question and we were talking about insulins and pregnancy, and I proposed the question during pregnancy, which is better, metformin or insulin? The correct answer was insulin. But then I went on to explain it, and I think the way I explained it and what I was saying made some students think that metformin wasn't good for pregnancy. It's not that metformin is not good for pregnancy. It's just that with insulin, compared to metformin, insulin is the proper choice. Okay? Okay. Where the content resides, it's here. Shout out to my nurses in Trinidad. All right, I got them in the house. All right, Dallas, Texas, of course. My American nurses, Maryland. I love you guys. Aloha from Hawaii, representing the United States. We have an international family here. If it's your first time joining, again, my name is Regina MSN. I am so happy to see you. We are studying our virtual trainer. Now, on the calendar, we had a ton of stuff to do, clinical judgments, psych medications. And so that's what I did on this beautiful day. So are you guys ready? I want to see comments on the screen. Fast thinking time. You guys showed up for a study session, and I'm going to give it to you. Okay. Hardcore Regina. She's back. She's back. All right. Question number one. Pharmacological focus. This is the first question. All right. ¿Tú estás listas? Let's go. All right. An elderly client has been going to Bible study every Wednesday for the past 4 years. They miss a session because they totally forget. Is this normal or a sign of Alzheimer's? What do you guys think? Again, an elderly client has been going to Bible study for the past 4 years. All right, Wednesday night Bible study, and they miss a session. They totally forget it. Is this normal aging or a sign of Alzheimer's? Woo! Did you study the content today? Did you study the content today? I want you to use what we learned, okay? Use what we learned about dementia, delirium. If you got this scenario on NCLEX, what would you say? What would be the appropriate answer? Okay. All right. So this would be some of y'all are going to be upset. This would be a sign of potential Alzheimer's. Somebody tell me why. Tell me why. We're talking about an elderly client. We're talking about them going to Bible study on Wednesdays for the past 4 years. and they don't show up, they miss a session because they totally forget. All right, I'm telling you, if you see this on NCLEX, why? What is the indicator there? What is the indicator? Share this video. We are going in tonight. We are going in tonight. And the themes that I will be covering again are from the NCLEX virtual trainer. So we learned the content in the VT, and then I'm coming to press you guys. I'm pressing you guys today. All right. Because for NCLEX, all right, what we learned for NCLEX, what we learned about Alzheimer's is that the elderly, they will forget things that they have done a long period of time. Okay, so when the elderly, they forget things that they do commonly, their routines, they forget, okay, where they go, they forget how to cook their favorite meals, they forget their favorite book for a long period of time. I said 4 years. How many days of that in 4 years? All right. So that is long-term memory. All right. That is that's a long-term thing that they've been doing, and they forget it. Okay. They forget it. So that is going to be a sign of potential Alzheimer's in an elderly client. All right. Okay. I'm going to move on. All right. You guys are learning today. This is a dialogue. You can talk amongst yourselves, but I have to move on. Number 2, an elderly client forgets the name of their new neighbor's daughter, but remembers it later on. Is this Alzheimer's or is this normal aging? What do you guys say? An elderly client forgets the name of their new neighbor's daughter, but remembers it later on, a few hours later. Is this Alzheimer's or normal? Okay, let's go, Remar nurses. It's late in the day, but we are still reviewing. We're reviewing. Yes, I love it. Remar nurses, the correct answer is going to be, it's normal. That is normal. This is a new neighbor, right? That was the key word there. This was a new neighbor's daughter, and you don't remember it. So sometimes if an elderly person is speaking and it's just like a word is on the tip of their tongue, but they recall it. All right, they recall it. They catch it. They recall it. All right, then that is going to be normal. That's going to be normal. Hello there. This is 30-day NCLEX challenge. We are digging in tonight. Okay. Also, so remember, study the stages of dementia. Those are important. You got to know all of those. Tamara says, I don't even know my neighbors' names. I can't even pronounce their names. You got to study all of the signs of Alzheimer's. This is on page 125. All right, get in there early, moderate, and severe or late. Okay, next question. Which medication class did we study today that can be used to treat anxiety, treat alcohol withdrawal, and treat insomnia, but is habit forming? Which medication class can be used to treat anxiety, alcohol withdrawal, insomnia, but is habit forming? What saith you all? Remar nurses, go ahead. Comments on the screen. I want to see those comments. I want 1,000 comments tonight. There's almost 600 nurses right now, so we can do 1,000 comments. Put on the screen. It was on page yada yada yada. It was on page, what page is it on? Okay, it was on page 128. Okay, 128. I see it. Yes, the benzodiazepines. All right, make sure you don't just know the class, make sure you know the entire examples that I gave you. The NCLEX will ask about specific medications for that. Okay. Yes, we are doing this by God's grace. We are going to pass our NCLEX. We are going to do it. All right. Next question. Here it is. Amitriptyline. 600 nurses. All right. Smash that share button. You guys, this is going to be big. Amitriptyline is what kind of medication? What kind of medication is it? What kind of medication is it? Yes, 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 yes. The last answer was benzodiazepines. I have moved on. Psychiatric medications is a challenging. If you have the DVD program, you might not have this specific one in your workbook because I added. The answer is yes, tricyclic. All right, antidepressants. So I added the TCAs in with the virtual trainer. All right. So that was one of the things I included in the VT. Okay. Good job. Tricyclic antidepressants. Here we go. I'm moving on to the next question. It's this. If a client is speaking and the nurse cannot make out the language, which positive sign of schizophrenia is this? Which positive sign of schizophrenia is this? Woo. 127, page 127. If a client is speaking and the nurse cannot make out the language, which positive sign of schizophrenia is this? I want to see the answers on the screen. All right, first answer to get it right. Go ahead and put them up on the screen and make sure you know that you know this. Psychiatric nursing is challenging. It's challenging unless you love it. All right, so I gave you guys my cheat code, my cheat sheet. All right. Yes, 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 yes. Okay. Not confabulation. Not confabulation. Confabulation is when there's gaps in the patient's memory, and so they make up events. So that they say they don't really remember what they did yesterday. So they'll say, "Oh, I went to the zoo and it was amazing. I saw all kinds of animals." But you know that they were not at the zoo. That's confabulation. When a patient is speaking and the nurse can't make out the language, yes, Henry, yes, Peng, it is neologism. Neologism. It's neologisms. Okay. So the positive psychiatric symptoms that we talked about on 127. This is, which book do I have? The practical. This is the practical nurse workbook. So it's on page 127. So you got to know neologisms, hallucinations, delusions. These are all positives. All right. All right. Okay. This is another one. Are you guys ready? Here it is. Shout out to Bosie Johnson. Hello, Regina. I just passed the NCLEX. Thank you. Hey, I want you to send me a testimonial video so you can get the Remar Nurse shirt. Okay. That's what I want you to do. And you could just go to remarnurse.com/party. If you passed NCLEX with Remar and you want the t-shirt, go to remarnurse.com/party. Okay. All right. Here we go. Which client is most likely to be difficult if given directions from the nurse? Okay. Is it the manic or the depressed client? Which one? Which client is most likely to be difficult? All right. Difficult in giving and taking directions from the nurse. Okay. Which one? Which one? Tamara says, you are all over the loudspeaker in the neighborhood. How is that so? All right, here we go. Which client is most likely to be difficult in taking direction from the nurse? Is it going to be the manic patient or the depressed patient? All right, we went over this. This was a lecture point. Did you guys get it? Let me look at these answers here. Comments on the screen. Is the manic person going to be difficult or the depressed patient? Okay. And the correct answer, okay. I see what you guys are putting. Okay. The correct answer, and I'm trying to give you the points, but also on page 127 in the PN, which I think is 131 in the RN, the manic client is going to be defensive against authority. Defensive against authority. Okay, guys. And you can kind of think about why, from what we went over, kind of think about why that might be. Why that might be. All right, that's a big thing because you have to teach these clients. All right, here we go. Question. When you are dealing with a psychiatric patient, when you're dealing with a psychiatric patient, which is more important to establish? Okay, which is more important to establish? Is it boundaries or trust? When you're dealing with a psychiatric patient, which is more important? Is it boundaries or is it trust? Which one do you guys think? What do you think? All right. Ooh. Because you guys know psychiatric patients, you know them. They don't have a sense of what reality. They usually don't have the same sense of reality. So, what do we need to establish with them? Do we need to establish boundaries or trust? What do you guys think? This is a good study session. This is so good. All right. We are hitting the major themes, all right, that we went over, some of the major themes. All right. All right. The correct answer. Oh, I see boundaries. I see lots of boundaries. You want to establish boundaries with these patients. Okay. That may sound good. And if you're presented, most of you guys can get it down to two choices, right? So if you're down to boundaries and you're down to trust, both of them are very important. Both are very important for psychiatric patients. However, the more important of the two is going to be trust. As the nurse, trust is the main foundation of a relationship with a psychiatric patient. They have to trust you. All right. They're not just going to take boundaries from you if you don't have a rapport with them. You have to build a good rapport. So that trust is going to be the foundation for everything else. It's going to be the foundation for your education, for them understanding that this is not a long-term relationship, for them taking direction from you. These are all major principles for your NCLEX exam, okay? So you have to have trust before you can establish boundaries, all right? So everybody that put boundaries, do you understand how that goes? All right, I know you do. I know you do. And this is why we come here. It's not about perfection, it's about progress. That's what this is about. And I'm doing this challenge so that you guys that are in the VT have that sense of progress. It already is, VT already is accountable. I mean, you're already held to a very high standard in the virtual trainer. But I'm challenging myself as well as challenging you because, I've never done anything like this before. Oh my goodness. Okay. Next question. Identify this statement. Identify this statement. If I said, I am a real princess. I have a real kingdom. I have servants. I have lands. I have duchess and lords. I am a princess. What kind of statement is that? What would you call that? What would you call that? It's a positive. It's a positive sign. All right. If I said I am a real princess, what would you name that? Put it on the screen or put it on the screen. Okay. And if you guys don't know what I'm talking about, you got to get into my program. All right. There's 700 people on here. This is my personal challenge to you. If you are on these lives and you have a good time studying, understand that this is just a very small portion of what is required. All right. The people on here that are rocking with me, they do the real work in their virtual trainer. They do the real work in the classroom. All right. They do the real work in my classroom, watching the full lectures. And then they come on here and they kill it. All right. They answer every question correctly. All right. And so that is what this challenge is also about too, is making sure you're showing up to your lectures. All right. Making sure that you are taking your notes and you have this workbook and you are studying. All right. I am doing this because I know that after, so many years of doing NCLEX prep, the lectures and the workbook are really the keys to success. They are really, truly the keys. Going into the classroom every day, great lecture, thank you, great lecture, straight to the point. Going into the classroom every day is what takes you from a very novice student to an expert in an area. All right. And when I say expert, I mean a brand new nurse expert. Okay. A brand new nurse expert. So you will know what is required. All right. So I'm talking about the statement, I am a princess. I am a real princess. The correct answer. All right. The correct answer is going to be, that is indeed a delusion. That is a delusion because I am giving a statement that has a false reality attached to it. All right. It is just, it's not true. It's a false statement that is not based in reality. And so we know that that is a delusion. All right. During the lectures, you go over hallucinations, you go over neologisms, echolalia, those things. All right. So shout out, you got that. Yes, you did. Good for you. All right. So I'm glad you caught it. Okay. I don't have many more, guys. All right. Tell me if this is therapeutic or non-therapeutic, because we went over this today. All right. Here we go. Here we go. You ready? All right. A client states they are afraid of their cancer diagnosis. Okay. A client states they are afraid of their cancer diagnosis, and the nurse responds with this: you are not the only person who has had cancer. Most people recover. Okay. Is this therapeutic or non-therapeutic? Okay. I'll say it again. Before you make a quick comment, let's hear it again, shall we? All right. A client states that they are afraid. What did I say? Yes, they are afraid of having cancer. They're afraid of their diagnosis. The nurse responds with, you are not the only person who's had cancer. Most people recover. What would you say? Therapeutic or non-therapeutic? I'm saying it with a smile. I'm saying it with a smile. All right. Do I have some mix? You know, sometimes I do stuff to throw in a little distractor there. Okay, you guys. All right. Oh my goodness. So most people on here think that that was non-therapeutic. Most people are thinking that's non-therapeutic. All right. This is the 30-day NCLEX challenge. I'm loving this. I actually am loving this. All right. So I made up the situation. The nurse says, all right, the nurse says, you are not the only person with cancer. Most people recover. All right. That is absolutely non-therapeutic. Even if she says it with a smile, what she is saying, tell me why that's not therapeutic. Tell me why it's not therapeutic. Matter of fact, because the client is saying, I am afraid. I am afraid of cancer. I'm so afraid. And the client, the response from the nurse is, you're not the only person with cancer. What if I would have said it like that? You ain't the only person with cancer. Okay. What is that doing for the client? That is not doing anything. Yes, that's dismissing the patient's feelings. You're not even addressing the concern. You're not even addressing it. All right. What does NCLEX want us to say? NCLEX wants us to say, what are you afraid about? Right? Not belittle the client and say, most people recover. What are you afraid of? Right? You're not the only person with cancer. Yes, I like that. I like that. I understand you are afraid. Tell me more. Okay. Yes, she didn't acknowledge their feelings. All right. And I like that because you didn't give the client room to express their concerns. No, you just shut them down. You just said, I don't want to hear it. You're not the only person with cancer on this floor. Everybody has cancer on the floor, right? So that's sometimes what happens. Let's talk about, I like that, Rose. Let's talk about it. Bonetta says, tell me your fears. Tell me more. Yes, those are therapeutic responses. Those are therapeutic responses. I love it. I love it. You guys are going to be excellent. All right. Tell me more. What don't you know about the disease? Yes. Yes, I love it. It's not therapeutic because she is comparing that client to another person. All right. Good, you guys. I couldn't get that one past you. Good job. Excellent. Okay. Do I have one more? Oh, I have one more. Okay. Here it is. Here's a good one. Okay. All right. A nurse is caring for a client. You ready? A nurse is caring for a client. We got almost 800 nurses on this live, y'all. Y'all are showing out tonight. Smash that share button. Let's go. All right. A nurse is caring for a client with mania, anxiety, and schizophrenia. Okay, those three. Mania, anxiety, schizophrenia. Which activity is best? Which activity is best? Is it playing a quiet card game or going for a brisk walk? Which one do you think? We have a nurse is caring for a client with mania, anxiety, and schizophrenia. Which activity is best? Playing a quiet card game or going for a brisk walk? Come on, Remar nurses. What do y'all think? Ooh, come on. Now, I came up with this based off of anxiety, mania, schizophrenia. Anxiety, mania, schizophrenia, and activities. Okay? Anxiety, mania, and schizophrenia. And this is what NCLEX does. It takes the content, it mashes it all up, and it spits out a scenario, right? All right. Which one do you guys think it's going to be? I am trusting that you did the work that you said you were going to do for today. All right. In your VT, I am trusting it. Let me see your answers. Let me read them. Okay. I have brisk walk. I have the quiet card game. Oh, I don't know. I don't know what to make of this. Did you guys watch the lectures today? Did you do it? Okay. Okay. The correct answer, the correct answer is going to be somebody says, go with the flow. Go with the flow. All right. The correct answer is going to be getting out and going for a brisk walk. Yes, that is going to be the correct answer for our patient with schizophrenia, mania, anxiety. You want them to take that brisk walk because it is going to exercise the large muscles, right? And what that's going to do is burn off that energy. Okay, Sharonda, we keeping you in prayer. You take your NCLEX in the morning. You got it. You got this. All right. So yes, when a client experiences mania, all right, when a client is anxious, or even a client who has schizophrenia, sometimes they don't know what to do with their self. They have so much. They have so much going on. And so much is just, they just have to feel like they have to go. And so having them to sit down, be quiet, and play this game of solitary is not going to work for them. They are going to be like, I can't even focus. I cannot play solitary. These cards, I can't be quiet. Okay. They are going to fail epically. And then you won't have, you won't have gained their trust because you've given them an impossible task to do. It is impossible for a client with mania to sit down and play a game of cards. Okay. It's not quiet cards too. Okay. So you guys have to be so very careful when you are reading these NCLEX scenarios. All right. You have to be so very careful because sometimes the distractors, they look so good and they sound so good, because when we think about if a patient's in the hospital, we do want them to be quiet. Right? But what is best for them is to blow off that energy, So review my psychological concepts in the virtual trainer. Please also don't forget to review the psychiatric medications. They are very important. And what I noticed is that there are some psych medications in the lectures, but also you have the psych medications. I review some of them in the quick facts. All right. Some of them are in your quick facts book, but I think you will get much more from the lectures on that topic. All right. Sometimes quick facts does a great job of explaining things, just short point by point, but you cannot do that. I find you cannot do that with psych. I find you cannot do that with the psychiatric medication. So for today's topic, the lecture book is going to be key for understanding. All right. Who can give a testimony that the psych was much easier after watching the lectures? I want somebody to give a testimony on that, because I think it's just the truth about it. Also, if you guys have some great study tips of how you're studying the psych medications from the virtual trainer, if the lectures were helpful to you, or if you decided to do something else with the material, let me know. Let me know in the comments. Tamara says, yes, ma'am. Yes, yes, yes. I'm telling you, when you watch the psychiatric lecture, I started with the diseases and the mania and depression, and I started with Alzheimer's and delirium. And so that really sets the tone for incorporating the medications into that. Okay. Virginia, yes, it was easy to understand. Perfect. All right. Okay, let me know. Teach me algebra. I can teach you algebra. What are you taking? The T's, the Hesse? All right. Okay, so I'm gonna spend the last 2 minutes. Is there any questions about the virtual trainer that you guys have, or the program, or the quick facts? I want to know that. All right. We play a game with the kids, and they get paid if they get the right answer. Okay. Velma, I have watched it 3 times. All right. Yes, yes, yes. All right. Thank you. Thank you guys. Thank you for studying with me. You guys are amazing. You guys are amazing for taking on this challenge. I find that the students who are successful are the ones who take the extra step to make sure that they're aligning themselves with their goals. So yes, I'm asking you, have you studied? But I also should be asking you, what steps have you taken today to align yourself with what you say you want to become? All right. And you have to ask yourself that all the time. What are you doing? What are you doing to make your dreams a reality? Because nobody's going to do it for you. All right. You have to do it. How long is the VT subscription? Your virtual trainer subscription is 90 days. It is 90 days. So you guys who purchase it now in January, March, April, May, you will have it until May, I believe. All right. How long? Let me see. Thank you. Oh man. How can you do some drug calculations? Please, please, please. Drug calculations are in your VT workbook. They are very hard to do on live the way I'm doing it. So I won't be doing any long math on this live. All right. 3 months. Congratulations to all of you guys who are passing NCLEX, and also those of you who are connecting me to your schools. Thank you so much. You guys are sending me dean's names, or if you have a program coordinator and you love the virtual trainer and you know your school needs help, shout out Remar. Send them my information and we will personally contact them. We have an amazing partnership we will be announcing with a huge online school. And I'm just so excited. I'm so excited because as we see how COVID is affecting everything, the virtual classrooms are going to be so needed for these nursing programs. So students who are studying alone at home, if you guys are interested in nursing school, best believe that you will be virtually than previous years. Everybody is shifting to the online or the virtual classroom. And the sad thing about it is for kids in school, because they will no longer have snow days, because now everybody is just prepped to do it online. All right. So there's no more snow days, really. They just won't exist. All right. So, yes, you can renew the program after. You can renew the program after 3 months. It's just $29 a month. And let me tell you guys this, everybody that's getting into the virtual trainer now, you're going to keep that $29 renewal, but that renewal price is going to go up. So those of you who purchased the review later on, you're going to have a higher renewal price. We dropped it so low, $29. And so that was a promotion. All right. How can okay, hold on. Let me see if I can block Noel. Noel, you've been getting on everybody's nerves. You really have. All right. So I don't know. Is he blocked now? I'm trying to. It's tough. All right. Okay. Um, let's see. All right. VT, if I have, does anyone know if I can complete the VT in 21 days? If I go at it day and night? um, you can. We have had people complete. Let me tell you this. What you're proposing to do is mind blowing. All right. The virtual trainer is tough, Andrea. You can complete it in 21 days. We have had people who completed in 21 days. We have people who completed in 2 weeks. But let me tell you, it is going to be a challenge for you. All right. And so my only concern is that you are able to retain all the information. Because for me, I would think that you would at least need to go through this book twice, and it may take you 2 or 3 passes to go through quick facts. All right, what do you guys think? I think this book 2 times, this book 3 times. That's just me. The VT student workbook twice, and the quick facts about 3 times. Only because quick facts has a lot in it, and so does the lectures. Tamara says no way, too much information. But if she's going at it day and night, you can actually finish it. All right, you can finish it, but this probably will be the only thing you're doing. All right. Tracy says I listened to the video 2 times, then fill out the book. Oh, okay. All right. Okay. Wow. That's cool. I like it. So you listen first and then you write. You must be an auditory learner. That's cool. Shaniqua says that's about type, but I review over it constantly. Yeah. You can do that. You can do it. All right, guys. So the renewal, let me tell you this, somebody did remind me, of course, the virtual trainer will automatically renew for the $29 after your 90 days is over. Okay, it will automatically renew, but you can always cancel your virtual trainer under your profile section, and then if you want to, you can just contact Team Remar and they will allow you to renew it. So people ask that all the time. If I buy the virtual trainer and I do the 90 days and then I want to stop it, can I stop it and then come back 3 or 4 months later? You can. I don't suggest that. I suggest you get in, study, take your exam, watch the lectures, watch them twice, and then, fill out the workbook. All right. Do it like that. But that's what I suggest. You just keep pushing at it. Keep pushing at it. Don't allow time to get in between you and your study material. Jennifer says, I listen 1 time, fill out the book, make cards, and have a friend question me with a card. It's a lot, but I feel confident. No, that's not a lot. That's perfect. Okay, that is perfect. I like that because it's your system. It's your system. It's what you have to do. All right. Let's see. Nika says, weakness is time. I get frustrated when I have questions wrong. How can I get better with increasing my question after a certain number? I start to get tired. Okay. I'm trying to understand the beginning of your statement, but you get frustrated when you get questions wrong. Okay, I can totally understand that. It is not easy to get questions wrong especially when you feel like you've really been studying. But I think you have to keep in mind that the purpose of studying is to learn new things. So keep this perspective. While I'm studying for NCLEX, it's okay if I get something wrong as long as I understand the correct answer. All right. In the end, I need to understand the correct answer. So if I see it again, I can get it right. All right. Sometimes when you're learning to walk, you fall down a lot. But over time, you walk and you stand up a lot longer. And that's what this is about. All right. That's what this is about. It doesn't matter how many times you fall. You come here every day. You get all the answers wrong. Guess what? I guarantee you after 30 days, you will still know more than had you never showed up. All right. And if you see this information on the exam, which you probably will, you'll know the answer. Okay. All right, Kimmy, I am new here. How do I get these things, Regina? It's very simple. You go to my website. My website is remarnurse.com. Okay. You go to remarnurse.com. And whether you are an RN or a PN, we have a program for you. Okay. So I was studying out of the PN workbook today. I've misplaced my RN workbook. So I just grabbed my PN and I went over it in the VT because I had access to both programs. So I was in the VT for the PNs today, but you can get the RN if you're an RN. Okay. So the remarnurse.com and get your NCLEX virtual trainer. Okay. Oh, and also if you are an international nurse, go ahead and put the package that says international nurse, meaning you live outside of the United States. That's the package that you want. All right. All right. Renati, did I say that right? I've been studying, but I have problems retaining the information. Thank God for my 10-year-old daughter. She is helping me. Thank God. Yes, the Lord sends us help in so many ways. Let me tell you this. Before I got on live, my daughter came in, Salome, and she says, "Mommy," she knocked on the door because the door is closed. So she knocked on the recording studio door, and she said, "Mommy, I got something for you to help you with your live so that you're more confident." And I'm like, "Okay, Salome," because it's past her bedtime. And I said, "Bring it in." And so she pulls this out. This is my 6-year-old daughter. She pulls out this paper. All right. And on this paper, y'all got to see this. On this paper is the Remar virtual trainer system. So she actually made a VT, a quick facts. She made little icons, a quick facts 5-star, the original quick facts, RN and LPN VT student workbooks. And she made these for me so that I would not forget to tell you guys what to get. All right. And then on the back of it, she did the logo, the Remar, and she did my initials. She did the website. Like, these are all things that I was supposed to remember to tell you guys. And so Salome, she thought about helping her mommy tonight. All right. So this is what we have. These are the people who are depending on us to get to the next level. All right. So just like my daughter is there to help me, your daughter is helping you. This is what it is all about. The little people that are like, "Mommy, you can do this." They believe in us, right? They believe in us. So the problem is we have to believe in ourselves. And it's so hard for nurses to do that. It's so hard for nurses to put themselves first. Yes, kids have amazing insight. I mean, literally, the girl put 5-star quick facts. Oh my goodness. All right. I see another question I think that's really good, and that is about quick facts, the skills in the 5-star quick facts. If you have the original quick facts, there is no skills section, but the 5-star quick facts does have a skills section. So what I can say about it is I put the skills section on here so that you guys can read through them. All right. Read through and test yourselves. All right. You don't in no wise do you have to I do not expect you to memorize these skills. Okay. I don't expect you to memorize them verbatim. Like, oh, step 1 is this, step 2 is this, but you do have to have a good knowledge of these skills. So that's why I did the little quiz at the back. All right. And what you can do is I have on the calendar when you should be studying what skill, but if it's too much for you for that day, then just take one skill at a time. Some skills are longer than others. Okay. So drawing up mixed insulins, it's a lot of steps to read. Now, you don't have to memorize every step, gather the equipment, the next after that. But if I asked you, what do you draw up first? regular or intermediate insulin, you better know the answer to that. Okay. All right. And so what I did is on page 80, there is the clinical skills list, and it's just a little checklist of the questions to ask yourselves. Okay. So just little things. I mean, I don't know how to say it exactly, but out of the skills that are here, there's just certain things you got to know. Okay. So if you're inserting a urinary bladder, you have to know where it goes. Okay. And so I put it on here so that you can read through it and make a reference to say, do I have an understanding of how this procedure works? Okay. Do I know where I'm inserting things? If I talk about putting a battery in an ear hearing device, right? Do I know what side of the battery needs to be facing up? All right. Things like that. Inserting an NG tube. Do I know the measurements for that? Okay. So just those are the kind of things. All right. It's not a step-by-step memorization, but it is a reading over it so you're familiar with it. All right. So like think of it like this. Like if you read a Bible story, okay, this is just how I'm thinking. If you read the Bible and it tells a story, you don't have to necessarily know, okay, Genesis 30 verse 30, Genesis 50, right? Genesis 50, Genesis 37, like verse 3 says this. You don't have to know it, but you do have to know that Joseph buried his father, right? You do have to know that. You don't have to know exactly where the scripture is, but you do have to be able to tell the story, right? You do got to be able to tell the story of Noah in the ark, and there was a flood. You do got to be able to do that. Does that make sense? I don't know how to explain it. Did I do a good job with that, Mark? That was good. Okay. All right. So that's what I want to say about that. All right. Now, anything else about the exam? We're all studying for NCLEX. If you're not studying for NCLEX, you're still in nursing school, and that's fine. We want you here too, because a lot of the content that we go over is content that will show up on your exit exams, okay? And it will make you stronger for your exit exams into your licensure exam, all right? Okay, guys. Somebody said, yes, that's good. All right. Let's see. Thank you so much for your help. I'll pass my NCLEX. All right. What about questions? Check all that apply. All right. Select all that apply questions. They are very common on the NCLEX exam. They will remain, even though the NCLEX, will potentially change for the future in 2023 or 2022. Don't worry. They will always be there because select all that apply questions are very content heavy questions, and they make you show what you know about a topic. So my best advice is to know the topic very thoroughly. Know it so much that you could tell the story of it. And so that's what I'm on, right? Telling the story of the topic, and then those select all that apply questions become a lot easier. I promise you they will. All right. All right. Does anybody agree with that? Yes. All right. So tomorrow, if you guys want to, you can send an email out to Team Remar at support@remarreview.com. Okay. Support@remarreview if you have any other questions about how the virtual trainer works. Again, my program is an online platform, so you get immediate access to all of my lectures, my practice exams, all of my motivation that I've ever done. Well, not ever done, but the most current motivations, I would say. And also, you get the activities, you get the fundamentals. That's all online, and then we ship you out 2 amazing books as well. So my program is online plus physical workbooks to really make you have that classroom experience, but the online portion gives you the accountability and the tracking. All right, so that's why I did it that way. Thank you so much. All right. Okay, so somebody asked a question. I will be graduating in 3 weeks. When should I get the VT? I would say get it now. Get into it. You may see some information in the fundamentals that will be very helpful for you as you prepare to exit. Okay, as you prepare to exit. So see you guys later. I always say this: you can. You will, you must pass NCLEX. Also, tomorrow is a rest day, but I still will be coming back on for a little Q&A. And I may have some other surprises for you guys. So I'll see you tomorrow. Bye-bye.
That's right. The blood sugar drops. And so, just like with our diabetic patients, the pregnant mom will feel nauseated. She will feel weak. She will feel sick. So, what do you think we tell pregnant moms who have a low blood sugar? What do we tell them to do? Pregnant moms who have morning sickness, result of a low blood sugar, we tell them to eat dry carbohydrates. That's right. Just like our diabetic patients, we tell them to go ahead and eat dry carbohydrates. Also, to sit up after meals. When it comes to backache, it is such a common concern for pregnant moms. We tell them to use good posture and avoid spine curving. We tell them not to curve their spine inward. Also, they should use the pelvic rocking technique. Number 3 is leg cramps. To prevent or reduce leg cramps, we tell the mom to dorsiflex the foot. The diet for a pregnant mom should always be high protein with a prenatal vitamin. 5. Anemia is normal